Good evening, Bob, or good morning, Bob.
Happy time zone, Rita.
Thank you so much for accepting to have this conversation with us. I've always felt, as part of the Rotary Action Group, that we really know very little about each other because we are always in the business mode, doing Zoom calls, meetings. And what we miss in the action group is nothing but fellowship and friendship. That's the biggest thing that we miss. Otherwise, it's a beautiful action group, and we are all so dedicated and committed to it. So I thought, as an outgoing chair, you've been leading us so beautifully and so successfully for the last 3 years. So we must tell our members and we must tell the world who Bob Anthony is. So thank you, Bob. So
My pleasure.
thank you. My first question to you would be, anything you'd like to tell us about your personal life, your family, your hobbies, whatever?
Sure. So I am blessed in many ways. I grew up in a family with three older brothers and a younger sister. And I am blessed today with two grown men as children and a couple of grandchildren. And my wife, Nancy, is very supportive of the work that I did in the past as a career and my volunteer work with the Rotary Action Group on mental health initiatives.
Wonderful. At least now I know a little bit about you. And what about your professional background and career, Bob? You're not a mental health professional, we know that.
Correct. I was always in the technical fields. I had worked through MBA for business and the certified public accounting license at the same time as my wife Nancy completed her CPA as well. So the first professional job was with Touche Ross and Company on the management consulting side, specifically in manufacturing systems consulting. And that brought me to New England to work for a digital equipment company. And eventually I was able to get into the field of systems integration. So I was always in the technical industry and often in the remote technology, connecting wireless devices with existing computer systems. And I finished my career running a systems integration company.
Wow. So what's your interest in mental health? What attracts you to mental health?
Yeah, so the tech industry was a roller coaster. There was really good years and really tough years. The bout of depression occurred when I left the company that I had started. I had a lot of things going on that I didn't recognize, didn't know what they were, and got diagnosed with depression. So eventually worked through treatment, and looking back, was still angry that at age 50, I was surprised by these symptoms and thought things would have been a lot easier if I had been aware of what the symptoms were and how to manage them earlier, age 40 or age 30 or age 20. And realistically, these symptoms were there, clearly by age 10. So I started a nonprofit called Adolescent Wellness, and it is formed and provides information on not just early treatment, but even preventive activities, coping skills. I call them life skills, but in the vernacular of you professionals, they're coping skills development. So that is the work that when I joined the Rotary Club in Wellesley, Massachusetts, they encouraged me to introduce to launch an Interact Club. So I was able to do that in District 7910 around Boston.
And when was that, Bob? When did you establish the wellness, adolescent wellness?
That goes back to 2005,
2005.
so 20 years ago.
And you left your IT company.
Yeah, I just couldn't go to work anymore. I literally would collapse, by early afternoon. And
I
it was,
really didn't know you had suffered depression.
yeah. So, and I really didn't know what it was. I thought I was tired.
And how are you today?
Say that again, Rita.
How are you today?
I am very well. I may occasionally recognize some symptoms developing, but through basic things that all hopefully know, simple things like sleep and nutrition and reducing alcohol and trying to be more social. And I've also found creative problem solving to be super helpful in my instance. I've actually attended conferences on creative problem solving. I think you would call it developing cognitive flexibility, but the same activities, same exercises. So
Yeah.
I'm very able to be aware of some early symptom development and manage it.
That's nice. Bob, you also have a foundation through which you do a lot of social initiatives and social.
So so thank you for bringing that up. The Swansea Foundation is actually a separate organization. I don't have anything directly to do with it, but my wife is a director.
Okay.
And they were funders of early treatment and prevention programs at McLean Hospital, Boston Children's Hospital, William James College, and others around the Boston area. We had an experience where they funded a curriculum that in the pilot school dropped the number of emergency psychiatric evaluations of their students from 13 a year down to 8, and the following year down to 7. Well, that's a dramatic success. Avoiding one psychiatric hospitalization is enough to pay for the program, and they literally cut it by 7 and then 8. So the enthusiasm for the project was high on my part to see it spread more widely, and I was stunned to find it put on the shelf after the proof. And the explanation was it was a project developed by the two competing hospitals of Boston Children's Hospital, McLean Hospital. Neither wanted to promote the curriculum because it would bring the other nonprofit into it. So then I learned nonprofits are more competitive than for-profit businesses. And that's the year I founded Adolescent Wellness, simply to make that curriculum available to all schools that were interested.
That was 2005. That was
Today is Break Free from Depression.
right.
And we've labeled it within Rotary as Wellness in the Box.
That's a beautiful program.
Yeah,
I have done that so successfully. It's so well structured. It's very well structured, and it's replicable, it's doable, it's scalable, it's impactful, sustainable. It has everything in it. I just love that program.
Yeah, it's also flexible. It's a solid framework with evidence-based, pre-post surveys attached, and people can put in their local content to keep it relevant.
Yeah. So, how long have you been associated with Boston Children's Hospital, Bob? Is it like at the time when you set up the adolescent wellness?
Even earlier, it is an icon in the Boston area. They do remarkable work in all areas, including child psychiatry. So, you know, when my younger son was still, a toddler, he had a physical surgery that was required. And, it was a joy to be able to have that scheduled at Boston Children's Hospital. And ever since, we've been champions of them as an institution.
Yeah, yeah, I understand. And when did you start your journey in Rotary? Like, when did you join Rotary?
Yeah, so probably a decade ago, I had joined the Rotary Club of Wellesley in Massachusetts. And it was a small club. And I had ulterior purposes. I wasn't trying to do good. I was trying to make sure it was convenient to attend Rotary meetings in Naples, Florida, because my condo was a block from where they met in Naples. So I joined the Wellesley Club just to be able to say I was a member of Rotary. And, you do a few projects selling pancakes at the local middle school or popcorn at the local concert to do fundraising. You hear stories from the other members that were strangers before you join the club. And you get hooked. You're interested, you're engaged. And one of the things that they suggested, seeing a nonprofit I had started, was applying some of those wellness activities with forming an Interact Club at the local high school.
Right.
So that was very fulfilling, and the kids actually taught that break free from depression curriculum to the entire freshman grade. They got higher scores than when the adults were teaching it. And we were able to make it available throughout the district, District 7910.
Yeah. And when did you join the Action Group on Mental Health?
I had attended a conference, I think in Atlanta, and saw the booth, met Bonnie. There was a couple of folks there,
so
and became a member. And
so, tell us how do you think of your achievements in the Action Group on Mental Health, and what is your vision for the future of this Action Group?
Yeah, so you really are normalizing the conversation. When I think back to 20 years ago now, when I was diagnosed with depression, part of the problem was not trusting I could tell anyone. I thought I was keeping it a secret even from my wife, which was pretty silly, but that's what was in my head. And normalizing the conversation allows self-awareness, it allows help seeking, allows the communication of our basic elements of the coping skills before you can even get to problem solving. So I love the message, and what I've seen since I joined the Rotary Action Group and Mental Health Initiatives is growth manyfold in the membership. The idea of a chapter, thanks to you, Rita, and creating the first chapter, District 33 chapter. And that was a model for what's possible in districts everywhere in the world.
Yeah. So what do you think is the future of our action group, and how do you see it growing and leaving its impact?
I think it's already started. I see programs that we share with others that are looking for some place, looking for something proven that they know can succeed. That's where we started. What's happening more and more now is we're hearing from clubs with their own resources, their own projects that have succeeded in their local area. And so we're making it easier for them to share that knowledge, to share that successful experience with other clubs, even in their region. Districts don't really talk to other districts that often. And specific to this topic, I think those conversations are too rare. We're making those conversations quite easy.
Yeah. And do you think, Bob, in the Rotary International ecosystem, mental health will take center stage, like polio or peace, because I think it's such a vital subject.
Yeah, I think there's great interest, and I think it's their number one opportunity for becoming better known by communities. Rotary too often is not in the headlines. Rotary is not very often in even a local newspaper, and people still need an explanation of what Rotary is. I think if we were stronger leaders in mental health, that would change. And I think that we're uniquely positioned because of our network to bring to healthcare providers what we know to be working in other areas, and to bring to the community what the healthcare providers wish more people were doing. So we're actually the go-betweens already. We're just not leveraging it very often. Yeah. So I really do think, even worldwide, our ability to communicate between different organizations within the community and among the communities is a rare resource. And it will get, with our help, it'll get discovered. And with Rotary International's prioritization, it would really be a powerful force. So nice to hear that, Bob. Thank you so much for sharing your thoughts and your time with us. Thank you so much. Thank you so much.